Only 10% of our mind is conscious. Meanwhile, subconscious doubts, fears and desires come out in the form of your dreams. Dream analysis is helpful to find the true meaning of your dreams. Different people cope differently. Individuals have their own coping strategies to deal with problems. Some may succumb to depression, while others are able to work better under pressure. The spring months of March, April, and May have consistently shown to have the highest suicide rate, 4 to 6% higher than the average for the rest of the year. Types of depression include major depression, dysthymia, adjustment disorders, and bipolar disorders. Within each of these main categories are several subtypes. Alcohol is a depressant, so are marijuana and a host of other recreational and street drugs. Self-medication is not going to get you better and will surely make you worse over time. Remember that all medications, including antidepressants, have side. The origin of depression can be situational and/or biochemical. If you are experiencing mild to moderate situational depression, resulting from the loss of a job, for example, counseling will help you. Most biochemical depressions that are moderate. Researchers have found a direct relationship between depression and the thickening of the lining of the carotid artery in women, a major risk factor for stroke. Overthinking is a special form of fear. This fear becomes worse when adding anticipation, memory, imagination, and emotion together. Unexpected reinforcements work best. When rewards are unexpected, there are better chances of good performance the next time. Only 10% of our mind is conscious. Meanwhile, subconscious doubts, fears and desires come out in the form of your dreams. Dream analysis is helpful to find the true meaning of your dreams. Part of depression recovery is to start mending broken relationships. This is a huge part of recovery and often an important one to step into the world. Mindful meditation can offer great insight into oneself, but it can be difficult to do as it is all about concentration. It should be done at the end of recovery. It can make one aware of the problems before it arises. The most common types of suicide include copycat, euthanasia, familicide, forced, honor, internet, martyrdom, ritual, attack, and cop suicides. Many creative individuals have experienced depression, including Robert Schumann, Ludwig van Beethoven, Peter Tchaikovsky, John Lennon, Edgar Allan Poe, Mark Twain, Georgia O'Keeffe, Vincent van Gogh, Ernest Hemingway, F. Scott Fitzgerald, and Sylvia. The spring months of March, April, and May have consistently shown to have the highest suicide rate, 4 to 6% higher than the average for the rest of the year. Depression can be as hard on your loved ones as it is on you. Those closest to you may start to feel unloved and may distance themselves so they aren't pulled into your pain. Remember that others are counting on you. Build good habits. Changing habits will change your life. You cannot change your future, but you can change your habits, and surely your habits will change your future. Regular breaks help us learn more. Allegedly, taking regular breaks while trying to memorize some material help us do it faster and more efficiently according to survey. A depressed woman is more likely to give birth early, increasing health risks for both the woman and the baby. Between 14 and 23% of pregnant women experience some sort of depressive disorder. Druids or priests of the Celtic people believed that those who killed themselves to accompany their dead friends will live with them in the afterlife. Personal or family history of depression, major life changes, trauma, stress, and certain medications can contribute to a higher risk of developing depression. Thanks for watching. Please like and subscribe.